I rise to ask question 16/2017 under my name, directed to Minister for Health and Medical Services. Can the Minister inform the House on why the Ministry is employing more locum doctors?
Honourable Minister for Health and Medical Services.
Thank you, Madam Speaker, and I thank the Honourable Member for the question. Madam Speaker, locums are typically doctors who work in private practice or who have recently retired from government services. These may include general practitioners who provide support in areas such as accident and emergency, pediatrics, and specialists who work in hospital inpatient and outpatient departments and can also offer valuable mentoring for their younger colleagues. Madam Speaker, in case of Ministry of Health and Medical Services, our use of locums is an excellent example of partnership between public and private health sectors, which is actually working well for the Ministry and making a real difference for our patients. Our locums are helping the Ministry to deliver on its goal of offering prompt access to quality health care for Fijians. And because locums can be called upon to work during hospitals' busiest periods, we have decided to engage locums in our local hospitals, subdivisional hospitals and health centres, with the times they work tailored to meet variations in demand, and of course we believe they are highly cost-effective. Since October 2016, Madam Speaker, with the revised rates for the locum appointments, a total of 40 locum doctors have joined the program, 30 general practitioners and 10 specialists. This initiative is coordinated by our ministry in partnership with the Fiji College of General Practitioners. Based on our current arrangement, the general practitioners are paid a rate of $50 an hour, while specialists are paid $80 an hour. These rates have proven effective in providing an incentive for the GPs and specialists who are ready to offer their services when and where they are required. In most cases, they work during peak hours, normally in the mornings between 6:30 a.m. to 10:30 a.m., and then in the evenings from 5 p.m. to 9 p.m. Madam Speaker, since the current program was launched late last year, we have actually started to receive reports of shorter waiting times and greater patient satisfaction. There are also benefits to our own doctors, whose workloads have become more manageable. Through the locum arrangements, the Ministry has been able to support CWM Hospital, Lautoka and Lambasa Hospitals, Makoi Health Centre, Samambula Health Centre, Lemi Health Centre, Rewanga Health Centre, Valley Level Health Centre, the Tamavua, Tomi and St. Giles Hospitals, as well as Nendi, Singatoka, Namaka and Va. Madam Speaker, locum doctors are engaged in delivering services, particularly in the following departments: accidents and emergency, anaesthetic, physicians, obstetrics and gynecology, eye unit and dermatology. Of course, there is a criteria in place for locum appointments. Applications are made through major and subdivisional hospitals, and it is made on a need basis. Doctors need to submit the annual practitioner's license with the application forms and other documentation as advised. On a broader perspective, Madam Speaker, the locum appointments also promotes opportunities for advanced learning, information sharing and broader networking between the doctors in our hospitals and those general practitioners for enhanced collaboration. Our discussions with the Fiji College of General Practitioners have received positive feedbacks as we continue to see new areas of support and partnership, local being one of the platforms. To date, we have spent a total of $442,478 on our locum appointments, and of course, if I may inform the House, this appointment is a short-term and a need basis arrangement. Thank you.
Thank you. And I give the floor to the Honourable Bonivalu.
Thank you, Madam Speaker. Supplementary question. What's the Ministry plans for the future of these local doctors or local appointments? Thank you, Madam Speaker.
Thank you, Honourable Minister.
Thank you, Madam Speaker, and I thank the Honourable Member for the question. I believe your question is what's a long-term plan for locum doctors? We have a 3-month appointment, and based on the performance reviews that we receive from our hospitals and subdivisional hospitals, we re-engage them for a further 3 months. Like I said, we will continue to use these arrangements till we are able to meet up with our doctor shortage currently that we face in Fiji.
Thank you. I give the floor to the Honourable Sarah.
Thank you, Madam Speaker, and thank you, Honourable Minister for Health, for your response, but you did not reflect any disadvantage to the program. The question is, locum is a sort of short-term arrangement to address doctor shortage. What plans does the Ministry have in the long term to address doctor shortage in the country?
Honorable Minister.
Thank you very much, Madam Speaker, and I thank the honourable member for the question. I think if I can give you some statistics, currently we have 1,095 medical officer positions, and to date we have 595 positions that have been filled. The long-term solution, however, is to ensure that the industry, the local institutions meet up with our demands, but unfortunately doctor training programs are range well over 5 to 6 years. We've just added about 70 interns to the service. The government also provides scholarships for training of our local people. The ministry, with the Ministry of Civil Service, is ongoing with its program for training in specialist areas. We are also looking at exploring our opportunities to recruit overseas doctors, as I mentioned in my last speech, and we are currently progressing with that. However, that is not a solution. We are trying to get more doctors out from our local institutions, but like I said, it's a long-term process. I agree, locums is a short-term process, but doctor shortage has been an ongoing problem for us in Fiji. And yes, for decades actually, and we are trying to make progress with that, and it will eventually take some time. So these are options available for us to ensure that we continue with our service delivery and ensure that we get that the patient satisfaction that we are looking at. It's not an easy thing, but we are going to make progress should we continue with these options that are available to us. Thank you.
Honorable
Thank you, Madam Speaker. I thank the Honourable Minister for her reply. We all know that Locum are employed because there is a shortage of doctors. Doctors take about 7 years to graduate from the medical school. What is the government policy? And most of these people studied there on government scholarship. What is the government policy on how many years should they work in government before they can resign or join another organization? What is the present government policy?
Honourable Minister.
Madam Speaker, thank you, and thank the honourable member for the question. I believe there is a bond agreement in place with those doctors that come out of our institutions, and they are supposed to serve the bond before they can join GP or... Madam Speaker, on that note as well, we are trying to retain most of our doctors, and I hope you are aware that doctors have been given a hefty pay rise, and we believe that the pay rise we will be able to retain our doctors in Fiji. Thank you.
Thank you. Honourable Politi.
Madam Speaker, just a supplementary question to the Honourable Minister for Health and Medical Services. What has the impact been since the increasing of numbers of the locum doctors?
Honourable Minister.
Thank you.
Thank you, Madam Speaker. One of the biggest impact that we have seen and had, actually, I have been going around visiting these health centres and our hospitals, subdivisional and divisional hospitals, and this is first-hand information that people have given. They say even one extra locum doctor that comes and serves during the peak hours makes a difference. So locum doctors, yes, they do have an impact on our waiting time, and it helps us with achieving our patient satisfaction that we are looking at. Thank you.
Thank you. Honourable Andre Vande.
Thank you, Madam Speaker. I would like to thank the Minister for the initiative meeting the short-term and the long-term challenges. My question is to the current one. The nursing practitioners and medical assistants doing the duties of doctors in the various centres, they are not properly remunerated. So how can the Minister remunerate these medical assistants and nursing practitioners doing the duties of medical doctors in those various health centres?
Thank you, Honourable Minister.
Madam Speaker, I believe that's a new question. If it can come as a question at a later date, I'll be more than happy to answer.
Thank you. I now give the floor to the Honourable Ratu Kiriraki.
Thank you, Madam Speaker. My question is, what is the position of
locating doctors in the rural areas, outer islands, maritime zone, because we had an instance in now where those the people were poisoned, and I understand the locum is mostly related to urban areas. Thank you, Madam Speaker.
Thank you, Honourable Minister.
Thank you very much, Madam Speaker. In relation to the question that the Honourable Member has asked, if I may just say, there is a total of 206 health facilities around Fiji, out of which we have 3 divisional hospitals, 2 specialized hospitals, St. Giles and Tamavua, 19 sub-divisional hospitals, including Rotuma, and we have 84 health centers and 98 nursing stations. Madam Speaker, our health centers operate at different times for the opening and closing of operations for our health centers. And our divisional hospitals and sub-divisional hospitals operate 24/7. The opening hours for health centers, I'm coming back to the doctor allocation, the opening health centers are guided by legislation, Public Hospitals and Dispensaries Act, Section 19, which states, quote, outpatients seeking attention at a public hospital or public dispensary shall, unless other arrangements are made in any particular case by a medical officer on the staff of such a hospital or dispensary, be seen except on public holidays between hours of 8:30 o'clock in the morning and 1 o'clock in the afternoon, and between the hours of 2 o'clock and 4 o'clock in the afternoon on Mondays and Fridays, inclusive and between the hours of 8:30 o'clock in the morning and 12 noon on Saturdays. On that arrangement, Madam Speaker, the health centers have a doctor present and the nursing staff present. Unfortunately, for the case of fish poisoning that is being mentioned, we had allocated doctors, the nurse was there, the doctor had accompanied a sick child for a pediatric case to CWM Hospital. And because of bad weather conditions, he was not able to go back. The nurse was there and constantly in phone contact with the doctor, who advised the nurse what to do and how to go to do about it. So the issue here is allocating doctors in rural and maritime areas. As we increase our doctor ratio, obviously our services will increase and we will be able to assign more doctors to these centers. Thank you.
Thank you. Honourable Rattusyalan.
Thank you, Madam Speaker. I do thank the Minister for the response given to date. As we all know that the shortage of doctors has been going on for some years now, does the Ministry have plans in mind to extend the retirement age of doctors from 55 to 60 or 65? Thank you, Madam Speaker.
Honourable Minister.
Thank you very much, Madam Speaker, and I thank the Honourable Member for the question. Yeah, a very interesting question. As you know, the retirement age is 55, but we do re-engage our medical personnel on a case-by-case basis, especially in terms of the expertise that the country currently lacks.
Thank you. And lastly, Honourable William.
Thank you, Madam Speaker. The Honourable Minister spoke about doctor ratio. Could she assure us that the ratio throughout Fiji is the same? Like Suva has high density and number per doctor, Nandrunga, Nandi, and Lotoka. Is it uniform or does it vary?
Thank you, Honourable Minister.
Thank you, Madam Speaker, and I thank the Honourable Gavuka for the question. I will be making a ministerial statement later in the week, and I hope to address your question there. Thank you.
Thank you.